Hello everyone, Dr. Shervin here from Artistic Dental Studio. Happy New Year! I hope you guys all have a very happy and prosperous year ahead, and welcome to our new series of videos for 2020. I'll try my best to make them as useful as possible, and obviously in a new format and under the new name of My Dental Tips. And I'm really excited here. As you can see, I'm by the ocean among all these beautiful people enjoying themselves, and the reason why I wanted to have my video here is because it's holiday season and it's trauma season. So my topic for today actually is covering dental trauma, and it's something relatively common these days. So after watching this video, you will have a good idea how you need to manage these cases before getting to a dentist. There are many forms of trauma involved in the head and neck region, and one of the most common ones is the avulsed tooth, or the tooth that has been knocked out. So what shall we do before getting to a dentist? Because it may take a while before we can get there, and it's very important that we take appropriate measures just to make sure we can save the tooth and we can minimize the adverse effects of such an incident. So to begin with, first of all, for any trauma directing at the head and neck region, you have to be careful to check for other injuries, like any concussion or anything like that, that could be even more important than a knocked out tooth. The second thing you need to make sure is that there is no serious bleeding going on, because you definitely have to stop it before attending to the tooth. And the third one is the tooth itself. First of all, you need to make sure what has happened. In many cases, the tooth that has come out is primary tooth. Children older than 5 years of age may have a mixture of primary and secondary teeth, and it's a little bit hard to distinguish between them. In general, primary teeth are much smaller and lighter in color than secondary teeth. And the way you treat this is totally different, because we do not put primary teeth back. But for the secondary or permanent ones, we need to put them back as quickly as possible. The second thing is that sometimes you cannot find the tooth. If you cannot find the tooth, it could either has gone into the bone because of pressure, or the child may have swallowed the tooth or even inhaled it. So you need to be really careful about this. If you can find the tooth, what you need to do is to just grab the tooth by the crown. Never touch the root, because cells that are remaining on the root are very important to create that lost connection again. So never touch a tooth by the root. The second thing is that most probably the tooth is not clean now, because it's been out of mouth. So you need to rinse the tooth, obviously, but what to rinse with? You either need to use dairy milk or saline. Never use water. Just bear in mind, never use water. And then try to replant the tooth as quickly as possible. Don't worry about the pain, because the child is already excited. So you can just put the tooth in there and push it in. If it doesn't go in for any given reason, there could be another cause, like fracture of the bone or something like that, and you definitely have to go to a dentist anyway. So just keep the tooth in a safe place. The sooner you put the tooth back, the more the chance you can save the tooth. After that, you need to use a kind of temporary splint to hold the replanted tooth in place. A temporary splint could be as easy as a piece of a tin foil. You just need to fold it around the tooth that you've put back and the neighboring teeth as well. So it could hold the tooth in place until you get to a dentist. Make sure the tetanus immunization is up to date as well. If you can't put the tooth back, you need to store it somehow. The best material is dairy milk. You can keep the tooth for 6 hours this way. If the milk is not available, store the tooth in a saline or saliva in a plastic wrap. Never allow the tooth to dry out, and never use water. Once you get to the dentist will evaluate the situation and put it back if not already done and possible. Prescribe some antibiotics, do a proper splinting of this tooth to the neighboring ones, and then you go from there. The thing that you need to be very careful about is that you need to replant the tooth as quickly as possible. And if you want to store it, never store it in water. I hope this video has been quite helpful to you guys. Please put your comments down below, and I'm more than happy to help you with this. Please stay tuned for the next video on tooth trauma, which will be covering tooth fractures and also trauma to the head and neck region. Thank you guys, and enjoy holiday season. See you in 2 weeks time. Bye.